Fox 5 Health News and researchers in the UK launching the first ever trial to see if you can get two different vaccine doses. If so, they say that this could give a huge boost to the rollout.
All right, joining us now, Dr. Parikh, Clinical Assistant Professor of Infectious Diseases and Immunology at NYU Langone. Now, I think it's important to note that they're studying if that is something we can do, but we should obviously not do that yet because there's no indication that that would be a safe or effective thing to do at this point.
Right. Yeah, absolutely. And I'm glad this study is being done so that way we know how to move forward if we do have shortages of vaccines. But currently it's not a good idea because, one, we don't know if delaying the second dose would mess with the efficacy or the side effects of the vaccine, or intermixing the two. You know, there might be unknown side effects from that, or it may not even have that efficacy that we would expect. So I think by June we should have some data as to whether or not that is a safe and effective option. And if it is, then that's great, and we can get more people vaccinated that way.
Oh, okay. So, doctor, this has actually become somewhat controversial. Should pregnant women get vaccinated? The WHO says that they should wait until more data comes out, but many experts in the U.S. don't agree with that assessment.
Right. You know, it's all risk versus benefit. What we do know is that, unfortunately, pregnancy is a high-risk condition for COVID-19 and from death from COVID-19 or severe COVID-19. So, again, there's two lives now at stake rather than one. And the real concern for pregnant women is live viruses being in the vaccine, but there are no live viruses in this vaccine. And the actual mRNA itself doesn't really stay in your body or bloodstream that long. So there's no real evidence that it would cross the placenta or even get into breast milk for lactating mothers. So, you know, if you're a high-risk group, I would probably advise to get the vaccine because we've all heard stories, unfortunately, where, you know, the baby was saved, but the mom wasn't, and vice versa. And you know, that's a tragedy.
I mean, is there doses available for pregnant women? I know we've seen all sorts of issues of just not being enough to go around. Are they at the top of the list? And if they go for, you know, pregnancy checkup, is that something they'd be able to get as part of that visit?
Yes, absolutely, especially if you're a high-risk pregnant woman. So I know many healthcare workers who are pregnant who've already become vaccinated because they're at much higher risk if they did get sick with COVID-19, and also if you have any of the other conditions that put you at higher risk, like heart disease or diabetes. So, you know, we're recommending that, again, if you're high risk, you should definitely consider getting vaccinated if you're pregnant or breastfeeding.
Gotcha. Makes sense.
Dr. Parikh, thank you so much.